This is Look West, a podcast from California's Assembly Democrats.
Hi, I'm Nairi Bagdasarian.
And I'm Andy Domick, and we're with Look West.
So we're on episode 3 of our Look West series on COVID-19 vaccines. In the previous episodes, we talked about trusted messengers like Secretary of State Dr. Shirley Weber, why they're so important, and what having them actually means to getting vaccines in arms of those who are maybe hesitant to take the vaccine. We talked about how and why we should all make a plan to get the vaccine for you and your family. And we talked with experts about how these are safe and effective vaccines and how they were developed in record time. And now we got a new topic. What are we talking about, Andy?
Vaccine equity. Who gets these vaccines? How do we make sure that the people who are most in need of getting them actually get them in their arms? Latinos are getting about 20% of the vaccines administered in California, but they make up about 40% of the state's population. Statewide, they've started implementing some programs that will reduce that inequity by setting aside 40% of vaccines for communities that haven't been getting them as much.
But we know it's more complicated than that, right? Especially since it's up to the individual counties to decide how they're rolling out these vaccines. And that's where our conversation starts with Assemblymember Dr. Joaquin Arambula, who represents the Fresno County area of the Central Valley. And during this entire time, he's been giving vaccines out himself.
What's really cool is Dr. Arambula has been volunteering his time to give vaccinations to elderly folks and farm workers. And Dr. Arambula takes the conversation in a really interesting direction when he speaks with public health experts about vaccine equity. Before we hear that conversation, he told us this great story about getting to vaccinate labor rights icon Dolores Huerta.
It's important when we are figuring out how to message and communicate with our community that we find trusted messengers who they will listen to and will appreciate hearing from. We were lucky in the Central Valley to have have been a force, an icon, a legend for many of us who grew up here in Dolores Huerta. Being born in Delano in the middle of that farm working movement, I know her importance for our campesinos, for the trabajadores, for the people who work every day in our camps and help to produce our bountiful harvest. But I had an honor and I had a privilege this past week among several of the 100 farm workers who I've vaccinated, among several of the 100 elders and seniors who we've vaccinated, to vaccinate a hero of mine in Dolores Huerta. It was an important moment as she helped to communicate and became that trusted messenger for our community about the importance of those vaccines for our farm workers. Really was proud to play a small role in being there at her side. I really was humbled and honored to play a small role.
I'd like to start today's conversation by talking about what vaccine rollout looks like, and it's different from county to county, but really want to focus on how we've been doing in Fresno County, and are there any lessons learned that we've had or best practices that we can share with the rest of the state. And to have that conversation, I've invited two great guests to participate today, Dr. Tania Pacheco-Werner, who I'll now allow to introduce herself, followed by Mr. Joe Prado.
Hi, I'm Tania Pacheco-Werner. I am the co-director of the Central Valley Health Policy Institute at Fresno State, and I am also one of the co-creators of the COVID-19 Health Equity Project, which is a community health worker-based approach to the pandemic.
Good morning, everybody. Joe Prado. I'm with the Fresno County Department of Public Health. I am the Community Health Division Manager, and currently in my role, I'm also the vaccine lead for Fresno County overall. So I get to lead these efforts with an amazing team here locally, and not just within Fresno County, throughout the entire community as well, just creating those partnerships and those collaborations. I am from the Central Valley, so I am a Kern County boy. So I definitely love to speak on this topic of equity as growing up in the Kern County area in Wasco specifically, just really grateful for this opportunity to speak on equity and vaccine rollout in Fresno County.
That's a great introduction, and if I I want to focus. Many of us who are in the Valley have been doing grassroots organizing for a while. We always appreciate being grassroots. Maybe it's because I was born in Delano in the middle of the farm workers movement, but appreciate the idea of community and being able to serve our community. But I want to introduce an idea for those who are listening about grass tops, that there are those who have an opportunity to see a bit broader than what we do with grassroots. And Mr. Joe Prado, I think that's your role for the county. I think that's how you have helped us to have this conversation about equity on a broader scale, and was hoping that you could talk specifically about your focus on hotspots as well as employers. And we will follow that question up with you, Dr. Tania Pacheco-Werner, about grassroots and how you've been organizing and working with CBOs to turn community out so that we can help to meet people where they're at and to talk about and to deal with their fears and anxieties. First, Joe Prado.
Great. Thank you. Well, during the pandemic response, even when we were talking about lab testing, we already knew which communities were going to be mostly impacted. We already have seen the level of health burden in our disadvantaged communities. So if we looked at our data, we looked at our census tracts, we knew our neighborhoods that were going to be impacted by this. So every time we laid out a plan, we looked at through the equity lens, who will be mostly impacted by it. So making these services, lab testing back then, available within those communities were really key. As we move forward within the vaccine rollout, it was very abundantly clear it was going to have to happen again, but times 1,000. And I say times 1,000 just because we're 6,000 square miles in Fresno County. And so we just can't have mass vaccination sites in the city of Fresno. We needed to be able to mobilize and be able to go out to the rural areas. And in addition, we already know our communities that are most impacted by this, there's issues with trust of government and trust of the system overall. And so we know that in our design, we needed to take care of the masses that are digitally available, that can actually connect to Wi-Fi, but we needed to address the rural area. But then we also had to deal with the issue of trust. And this was always part of our plan. And we've just been very fortunate that we had our COVID equity team alongside of us this entire way. And so Dr. Pacheco-Werner will talk a little bit about that more so, but just to understand the framework is we're not forgetting anybody in our community. We've set up our mass vaccination sites. We're setting them up in the rural areas. And now as we've got our data in, I can see doses being spread out strategically. So when we do our weekly who gets the doses, it's always through that lens of place matters. And so we put those doses in those communities. But that's just half the work. Just because you place doses there doesn't mean people are going to want to get vaccinated. And this is where that trust issue comes into place in our trusted messengers. And so that's where I believe Dr. Pacheco-Werner and her partnership with COVID Equity can really speak into what that next piece looks like after we get the doses in these neighborhoods.
Thank you, Joe, or as I like to refer to him, our local vaccine czar, because it really takes that level of big thinking and big planning to get rural communities vaccinated in a strategic way. And really what we knew from the beginning, backpedal to April 2020, as community-based organizations, we began talking to one another and saying, particularly our immigrant and refugee communities are going to be left out. They're going to be left out of the prevention. They're going to be left out of the testing, and they're going to be left out of when we have something that moves us forward. They're going to be left out of that. And so we knew that we had to help and mobilize and help be a tool, because we already had the sort of, as you can call it, the pulse on the ground in terms of, do people know the information that's coming out through the radio or through the TV or through websites? We know, we were able to say, yes, that information is getting to them. No, it's not. And so really, these community-based organizations have been working in their communities for decades. And I think that one of the biggest hurdles that we had was how do we actually reach people where they're at? Because they're not going to drive an hour and a half to a testing site in the city of Fresno if they live in a rural area. They're not going to go on a website and navigate a complicated registration system to have access to a test. So how can we help get people what they need at the time they need it? And now with vaccines, we are at that same place where we are telling people in their own language, in their own way of understanding, what is the vaccine? What are the things that you should watch out for? What are the reasons why you should get it? And in ways that really speak to them. And then we're also helping, working alongside the Fresno County Public Health to say, you know what, this is where we need to have an event. This is where we're seeing people not getting the information. And so, for example, staff will go to workplaces where the county is giving a workplace vaccines, and we'll provide them with the health education they need to make sure that they're prepared and that they sign up to get a vaccine. And in the coolest part, I think, that we're doing as of late is just telling people they qualify, because many people don't know what tiers are or the fact that they now qualify, or let alone where to go to sign up to get a vaccine. So our teams are going out into those rural areas, into the mom and pop shops, the grocery stores, the little restaurants, and telling them, you qualify. Here's how you can get vaccinated. And so just using all the tools in our toolbox to help people get vaccinated and to close that gap so that our most vulnerable can be the ones that also benefit from the solution today.
That's no, I was going to say that's really beautiful, Dr. Pacheco-Werner, having been out there in community, enjoying to serve my community. It's important for us to acknowledge this step forward. Many people in our community are starting to have hope as we're starting to distribute this vaccine, as we're starting to educate and inform them about its importance. We're starting to move forward together as a community. I have loved getting out into our unincorporated areas, meeting people where they're at, helping to talk about their concerns and anxieties so we can move forward. But I want to actually give some specific examples for other counties that they can work on, some actionable items. And so really want to talk, Joe Prado, if we can, about how you work with hotspots, how you identify those large employers so that we can make sure we can get those low-hanging fruit for some counties who might not be targeting those spots at the moment.
Our first biggest opportunity was in our Food and Ag initiative. So our Food and Ag initiative, we did this in January. What we did is we needed to find out logistically, what's it going to look like vaccinating our farm worker population, our packing houses, our essential workers in that space, knowing the linguistic issues, knowing the logistic issues. And so what we did is we went out and just took a risk. We took a risk that people were going to want to work with us. And we went to, and we identified particular indoor businesses that had significant outbreaks. And so we said, we want to vaccinate you early. It's not in the tier system yet, but we need to learn from this initiative. And so we really were able to target in areas of indoor packing, indoor facilities that had an outbreak. A mid-size indoor facility may or may not have had an outbreak. And then just outdoor workers. So that was a little more of a smaller model, but we wanted to see logistically how we can bring them together. And I remember we put together a Food and Ag Advisory Committee, and they've been together discussing the regulations. And I remember sitting with them and saying, okay, it's time for you guys to run a medical clinic. And there were some chuckles, and they're like, well, we're not medical providers. Don't worry about it. But you understand logistics. And as soon as you said logistics, every business knows logistics frontwards and backwards. They are a huge asset in your community. They can manage the logistics. You just needed to provide them a clinical partner. And so as we embedded on this first part of our initiative, we said 3,000 doses were on the table. And we thought we were only going to have 3 partners. I think we ended up having 6 partners for about 3,200 doses. And we were just trying it all out. And what we found out was the business partners, they found their own solutions. So for, county health departments, don't be intimidated by it. They will find their solutions. You just have to give them the framework to operate under and that clinical partner. And so we had clinical partners from Safeway. We had regular clinic, federally qualified health centers, and we have county clinical team that really service this here as well. We had our local university, Fresno State mobile team went out to serve the Food and Ag Initiative. And all we did was build a framework. That's all we did at the beginning. And it extremely successful. Did it have some bumps? Absolutely had some bumps. Don't expect, nothing's going to go perfect. Just throw that out the window. This is COVID. Don't worry about it. But really, you're creating a framework for people to get comfortable that they're not medical providers, but they can organize and they can communicate well. Pre-education is key. Pre-education before all our events was mandatory in our initiative, and we continue doing that. That is where you get the population that is on the fence or people who are just absolutely telling you no, but with that education, you're converting them to a yes, and they're more comfortable in making their decision. That was extremely important. What also was important is we developed a running list of businesses that really wanted to do it, and we told them, we funded the first part of it, but moving forward, a business, you can fund your clinical partner in the future. And the ones that are ready, and we use the terms everybody's familiar with, if you are shovel ready and the doses come in, we will go ahead and send you those doses. It was so great the other week when we got that additional doses. I looked to the Food and Ag Committee and I said, you have 10,000 doses. I want your plans in 3 days. They had it all figured out in 3 days, 10,000 doses out the door. That was amazing. The Food and Ag community really came together. And so I think as we think of this framework and they continue to build, we have to look to our local businesses. They can figure out some of the logistics parts with us and really be able to coordinate with them as we move forward through the vaccination campaign.
Dr. Pacheco-Werner, I was hoping you could comment a little bit, since pre-education is so important prior to vaccine distribution, about the importance of language access, about the importance of solving issues like transportation, about the fact that many people in our rural communities don't have access to internet or have computers. And so can you talk about the role that CBOs play in helping to make sure that we're overcoming those barriers to distribute the vaccine equitably?
Thank you, Assemblymember. I talked about the rural communities and their challenges, but it's also so important to know that people living in the middle of a city can also be socially isolated, can also be lacking internet access. For example, in one of the places in Fresno that's within the city, Southwest Fresno, predominantly Latino and African American community, they don't have the same internet as everybody else. And so to say, come online, register, right, that's going to be a barrier for people. And so I think it's important to note that barriers exist no matter where people live, and our communities of color are specifically in need of not only language access, but cultural access as well. And so one of the things that is key is that one-on-one interaction. So for us, that really means going and meeting people where they're at their place of employment, not only for the actual vaccine events when we're working with a business partner, but even just as a canvassing, just inviting yourself in and letting them know the vaccine is available and it's for you. Because it doesn't feel like so for example, I live in a small town, and I've been telling our grocery workers, and they're shocked that it's their turn. They feel like it's a privilege that they didn't know that they had access to. And that is what our communities are facing. And so I really feel like a community health worker model or work partnering with community-based organizations is key, because then you don't need to retrain staff. Community-based organizations go out and talk to people all day, every day. So they know how to do this. And I think it's just important, just equipping them with the tools, and they're ready to go. The community health workers we've worked with, we've trained them in Spanish, we've trained them in English. Their leads have trained them in other languages to get information on what is mRNA, what does the vaccine alter your DNA, what is the Janssen vaccine even. We just had our training this week about that. So, community health workers, community-based organizations are not only best at communicating, but they're also really capable of learning the complex information needed to transmit to the community.
That's a great segue, and it allows me to then highlight the fact that the governor has also identified and noticed the importance of CBOs. Just this past week, we saw him place funding, over $50 million, into 337 different nonprofits who are doing this work. Having worked with a few on those front lines, I do want to highlight the work of Cultivar la Salud and Leadership Council for Justice and Accountability, who have helped to organize and bend the boots on the ground for the events that we have put together. But know that we would not have been successful without their efforts, without their determination, without their knowledge of the community and ability to be a trusted messenger. And so really do highlight and elevate the hard work of those who know their communities better, but want to, if I can, really dig into this idea of meeting people where they are at. It was actually that you, Dr. Pacheco-Werner, had to go out with a mobile health clinic to many of these places. It's been me partnering with the Fresno State mobile health nursing units to be able to get resources out into our more rural and yes, our urban underserved areas as well. And so I was hoping to bring you and Joe Prado and figure out how we coordinate and really work with our mobile units to make sure that we are meeting people where they are at.
Yeah, I think our mobile units are key, and they're going to be sustained throughout the entire response. I think that's where, as we're opening up the tiers, that is a great resource for us to have to be able to hit these communities. At the same time, the mobile units need to have the right education partners. They need to have the right faces showing up in their communities. And so I love the trusted messengers, and that's what they're attached to. They're attached to a CBO of that community that have had history with, whether it be COVID testing or just prior to COVID, they already had a relationship there. And that's something I think that's key for all the counties. For the counties to be able to contract outside the government walls is extremely important. This public health is no longer within the government walls. It is out in our community. And so as we work on these contracts, we need to give those CBOs those flexibilities contractually within their scopes of work to really maneuver. And what do I mean by that? Ethnic media. Ethnic media, we need large-scale social media, great, yes, absolutely, but ethnic media is really key. So funding ethnic media within these contracts are important. And so that's where we have to continue to be innovative with our rural mobile and our urban mobile units, sustainability, but the education has to come in different ways and formats as well. So I think that's how we get to this hard to reach population, to where the big mass vaccination sites will get us some numbers, but we really need to continue to stay targeted in our efforts with vaccine in our hard to reach communities.
I've been really impressed, Dr. Pacheco-Werner, with the work you've done with the UCSF COVID Equity Project, and was hoping that you could take a few minutes and comment on that and how it's helped our response in Fresno County.
Yeah, so with a medical partner and in partnership with Fresno County, we have given access first to testing and now vaccines in an extremely low barrier setting. What does that mean? What does low barrier setting mean? It means they're in a neighborhood that's readily accessible, either by public transportation or within a neighborhood that is one of the hotspots. And also, you don't make any strings attached to getting there. It's on a first come, first served basis. And so that really allows people to say, okay, we know that they're here Monday through Friday and on Saturdays at this time. This is where they're going to be. I don't need to plan anything I just need to know that if I have time, I'm going to be able to go on that day and they're going to be able to vaccinate me. And I just really feel like we need all the models, right? We need every tool in our toolbox. We need the mass vaccination sites, but we need all the way down to these low barrier sites that are vaccinating our homeless population, that are vaccinating our population that does not know how to read or write. And so they have to register in the moment right there with a medical assistant or a community health worker helping them out. And I really feel like this model is something that we need to be recreating for not just the pandemic, but for preventive health in the future. I really feel like this low barrier healthcare has opened the doors, and we should be thinking around California, because we're innovators, how we keep this type of model going so that our most vulnerable communities can get the health care that they need.
I love that, and would love to talk about systems changes necessary for us not to have the results we had during this pandemic, because unfortunately we have seen the disparities that are borne out when we have our current system, and it necessitates us to talk about change and the importance for us to make improvements. And central to that for me is making sure we are providing needed care where people are at in a language that they understand with trusted messengers, and believe that will be central to how we can rise out of this pandemic stronger than we went into it. Really want to take a moment, if I can, and now see if you have any final and closing thoughts and things that you would like to share with our audience. And if we can, we will start with you, Joe Prado.
I think this response has taught us a lot in our department, in our county, that relationships, trust, and collaboration is key. The business model that I mentioned to you, there's a lot of people coming together that were on opposite sides before, but we are coming together as a county, as a group, because we have a common goal. And so for me, as I think of public health in the future, let's find that common goal again. Let's come together again post-COVID. Let's create those systems and the funding structures that allow that as well, because then we can become a healthier Fresno County. We don't have to be the most health burdened or disadvantaged community in the state of California. We will do better with us working together. And so that's what I'm even more excited about. I'm even more excited about where we're going to become post-COVID, because we've got a lot of battle wounds. We've got a lot of scars. COVID has given us that. But wow, it's given us a really good foundation also that we can build on. And so I'm really excited about what's going to happen to our equity lens post-COVID, because I think we've got a really good start here, and I want us to continue to build on it.
Thank you, Joe. I feel like the idea of looking towards the future is so essential, because I really do feel like this pandemic has necessitated us to break models, to break molds, and so we can't go back. There is no going back, and so there is only going boldly forward and knowing that trying new things can have good outcomes. And I see that when I see that we have events in places that have had outbreaks in a rural community that takes 40 minutes to get to the main city, that has 350 people show up to be vaccinated in one morning, right? I know that people want to participate in healthcare, and I think now is the time to just think about how we make this into not only a way of doing things at a systems level, but how we hire people from those communities, which is what we've done with the COVID-19 Equity Project, how we hire people from those communities and also give them the resources that they need for this to be a healthcare workforce opportunity that will help the healthcare access that is lacking in many parts of California.
I really appreciate the tone of this conversation and how collaborative we have all been together. During this pandemic, we have realized that the health of each of us is dependent on the health of all of us, that we are all in this together, and thus we must make sure we have equitable distribution, that we uplift those who are vulnerable in our communities, that we are providing resources and making sure that we have low barriers to access care, and really have been impressed with much of the work that we've done in Fresno County collaboratively, and hope the rest of the state can look towards some of our best practices, but also look towards the lessons we've learned, look towards some of those scars so that they can learn from that. But I hope ultimately what they'll look towards is how we can effectively and equitably distribute this vaccine to those who need it. So hopefully you've been able to listen in, to learn a thing or two, and have appreciated the opportunity to be able to talk with you today. I will end, if I can, by starting the last pandemic. I was on the front lines of healthcare. It's a very different perspective when you're now working with the systems and figuring out how to make improvements. But I've never lost that perspective of community and being on the front lines and who it is that we're serving. I think that's how we keep our focus on equity. That's how we keep the policies going in the right direction, is because ultimately we're serving Californians. I'm proud of the work that we're doing as California and how we are addressing this pandemic of the century. And hopefully those who are listening today will be able to learn a thing or two and make improvements in their communities as well.
Thank you.
Thank you.
Thank you to Dr. Arambula and our guests for talking about vaccine equity and helping us continue this conversation. It's certainly not done, so I anticipate more episodes on this topic. But for now, I'm Nairi Bagdasarian.
And I'm Andy Domick. You've been listening to Look West.
The Look West podcast is produced by the California Assembly Democrats. When you think of California and politics, remember to look west.